I'm sure that you have also heard and seen videos of Kwabena Mintah Kando, Minister for Health, MP for Dwaboso, with Alassane Chaib's Suhini, Deputy Minister for Roads and Highways, and MP for Tamale North, in that, unpleasant, argument with the doctors at the Tamale Teaching Hospital. The suggestion that this sacking of the CEO had happened because somebody felt an ego rise and acted with hot blood, etc., can be made. But also to emphasize the point that, and yesterday they donated some things, put their things up, let's talk about them. Also to add that, look, for the doctor to have said that, the death of a certain Salim who is 31 years is a cherished member of his family, was being blown out of proportion, it didn't make sense to me. Well, people die every day anyway. Is that what the doctor is suggesting? That people die anywhere, every day anyway? You cannot say that the death of an individual is being blown out of proportion. Do you know what that individual does for his family? Do you know what the family has lost because that individual died? It may not have been your fault. But let us season our words with salt, so that they taste good in our own mouths before we spew it out. The doctors are grandstanding everybody. The nurses are grandstanding everybody. They are not happy. Bernard Okoboy says, Mintah Kando, call them. Let them come. Have a meeting with them. And then the question that comes to mind is, the doctors are demanding an apology. What exactly is the Minister for Health and is the Deputy Minister for Roads and Highways, what exactly are they going to be apologizing for? That they had an unannounced visit to the hospital, that they found that the washroom was dirty, that they found that there was a water problem, that they spoke about the death of Salim, which was becoming an issue up north in my beloved Dagman Kingdom. And then somebody said that, we are blowing this out of proportion. The minister said, you cannot say that. It is not right for you to say. But the doctor stuck to his grounds and on his grounds and said that. What exactly is Suhini and Mintah Kando supposed to be apologizing for? I want to know. Because so far, they have not, the doctors themselves who say we are grandstanding everybody because we are doctors and nurses and whatever it is, they have not told the people what the minister and the other deputy minister should be apologizing for. I am not saying that the minister and the deputy are right. They are human beings. They can't get it right all the time. They may be wrong. But what exactly are they supposed to be apologizing for? I want to understand. I want to know. The GMA should be telling us. Is the GMA happy that a doctor is telling the family and friends and the minister who they answer to, are they telling us that a doctor saying that somebody has died and the death is being blown out of proportion, does it make sense to them? Which part of the Hippocratic Oath that they took speaks about that? That somebody dies and they say, you are blowing it out of proportion. What nonsense is that? What nonsense is that? Because it doesn't make anything that doesn't make sense. It's nonsense, really. So maybe the GMA has to come back and tell us what exactly they are demanding an apology for. The doctors at the Tamale Teaching Hospital, they need to come and tell us what exactly people are going to be apologizing for. If they take time and they have a research department, they should go into the Tamale Township itself and ask people what their reviews are about the Tamale Teaching Hospital. They will hear it. I go to Tamale. I know Tamale. I go to Tamale very often. Once in a while, I'll pass through, but I go to Tamale very often. I put my ears on the ground. They need to do some self-introspection. Not to sit on a high horse. Look, a friend of mine who works in the UK, who is a senior nursing officer, said they got to a point that the mayor, he came pushing beds. The CEO of the hospital in Southampton, he came pushing beds to help because they felt that people were stranded, and he came pushing. When you go out there, the patients have rights. And they are the bosses, even on their sick bed, even if they are going to die, they remain the bosses. Here in our country, it is not the patient that is the boss. I said, I have sat in a queue before in a public hospital with somebody who is sick. A doctor emerges from the consulting room and says, Mapong, I've closed. Wait for the night doctor or afternoon shift doctor. He's coming. Wait. He'll come at 4. Can you go and do that? I said that the jobs that our doctors and nurses refuse to do here, when they travel out there, they do 12 times, 12 folds. Here they lord themselves over us. When they go there, they know. And because most of them know that what they have is a working visa, they know that as soon as you lose that job, unless you find another job immediately, you are on the next plane back to Ojakrom. They know. Must we always be begging? I'm saying what they're asking for the minister and the deputy minister to be begging. It's okay. What exactly are they going to be begging for? I'm asking that question. You run a hospital that washroom that is not functional, is dirty, stinky, smelling, is gathering all the bacteria and whatever it is. Somebody comes to talk about it because they have seen it, and you are raising concerns that you have to be apologized to. Apologize for what? If I were the minister, I'll let all of you go home. There are people waiting at home to come and serve. There are people who are jobless who are waiting for financial clearance. I will clear all of you and put them there. Enough of these ego trips. Enough. Show me the items that were taken there by the minister. You have had all these things. He had to take a minister to come to the place for you to be able to tell the minister that we don't have this, we don't have that, we don't have, because of that, we are going on strike. Ego trip. So why were you running the hospital? And why was even Hefra, why was Hefra looking on when you didn't have all these things? Why were they looking on when you didn't have all these things? And you were running. Is it really a teaching hospital? What were you running the hospital already teaching with? When cases are referred to you, how are you dealing with them? Look, 10 million in the past, the finance minister, 10 million, Dr. Amina, Adam, 10 million, we're told was released to you. It is supposed to be a legacy debt. People were threatening the supply, and the minister stood on his grounds and said, 10 million, give it to them. What did you use that money for? What was that money used for? Baby cry, stop the ego trip. Put the thing up. This is the letter. Dated the 26th of August, 2024. 10 million released to you. 2024, we are in 2025, August, September, October, November, December, January, February, March, April. Where did the money go? And the same problems persist. Was the money not released? Was the money not released? You are serving people, oh. I say, I have gone out, I've seen people, nurses and doctors who ordinarily, they won't do those things they do that, they won't do them here. But in Obronikrum, they do them. Stop the ego trips. But there are people waiting at home to get financial clearance, come and work. Let's see the donated items. Let me mention them one after the other. Digital spigonometer. There's bowl with stand, 3. Kickabout bucket. Instrument cabinet, 3. Word screen, 5. Operating lamp, 1. Delivery set, 5. ECG, 1. Emergency resuscitation trolleys, 5. Fetal stethoscope, 5. Ambu bag, 5. Nebulizer set, 20. Patient trolley, 5. Wheelchair, 10. Examination lamp, 3. Fetal heart detector, 4. ECG machine, 2. Bulb suction, 2. Oxygen concentrator, 5. Pipette tips, 10 to 100. I don't know what that means. Defibrillator, 4. Vino ultrasound scanner with accessories, 1. Low-stain plasma vent transport ventilator, 2. Voltage stabilizer, 3. Viral ICU ventilator, 2. Draga transport ventilator, 1. Draga ICU ventilators, 3. Draga ICU cardiac monitor, 6. Draga warmer, 1. Draga resuscitator, 1. Draga phototherapy, 2. Draga anesthesia machine, 2. Face masks, 20,000. Assorted sutures, 5,000. Draga infant incubators 2, and medicines and consumables. These were donated yesterday. Say you don't have these things. They have been given to you. The 10,000, the 10 million, what was it used for? I showed you the letter. What exactly was it used for? Let me move away from it.